So, hello to all the viewers. It is my pleasure and privilege to do this interview with a very dear friend and a student, Dr. Pushkar Pazhani, who has secured rank one in INISS DM Neurology AIIMS merit list and rank 3 in the common merit list. So Pushkar, this is a big achievement. So the results came around yesterday night. So at this moment, how are you feeling?
Yes, sir. First, thanks for the introduction, sir. It's very sweet of you, sir. I was not expecting it, sir. Actually, I was just going to sleep, and all of a sudden, the results had come. So I had done well, but it is a very pleasant surprise to be rank 1. So
Okay,
I'm happy.
and this is more special because this is the first ever INISS. So it's almost like your name goes to history, and both in the common merit list as well as AIIMS merit list.
Yes,
Personally also I'm happy because AIIMS merit list you have got rank 1,
yes,
and in the common merit list also one of my students, Ankit Pasi, has got rank 1. So
yes, sir.
very happy moment. So Pushkar, like a lot of viewers will be listening to you because obviously you might have post MD candidates, maybe medicine residents, first year residents, second year residents, final year residents. They would want to know regarding INISS, how to prepare for it. So first, let me begin by asking you this. So how was the exam pattern? That is the stage 1, the MCQ round. How was the exam pattern in INISS?
So regarding the exam pattern, since I had given the July session was at 90% neurology, sir. So I think most of us who had given the exam this time were pretty shocked because the weightage for general medicine was pretty high, sir. I think there were almost 50 questions from neurology and around 30 questions from general medicine, which was unexpected, sir. And the general medicine questions were all not core general medicine. They were like very tough questions, like something that a person who's preparing for that specialty would be expected to know. So that was difficult. And since most of us were expecting a predominantly neurology paper, it was tough, sir. I think most of us found it very tough.
But if I remember rightly, in the INISS mock test that we had done,
yes, sir,
I had put the questions as around, say, 55 questions around neurology and 25
yes,
questions.
I think you had predicted the exact weightage, I think a few days after the prospectus, sir. You had told us there might be a 70%, 30%. So I think we were all prepared for that. Since we were preparing for general medicine. So it was useful, sir. The tests were very useful. And so it's important that people should not, it's important to, the rank deciding questions will be from neurology, but it's vital that you do not ignore general medicine.
This is something very important that Pushkar is telling, because previously in the AIIMS exams, when we used to have separate exams, AIIMS was, just about neurology. But now, even if you want to get to AIIMS, Sri Chitra, NIMHANS, anywhere, you in the central institutes, you've got to be thorough with medicine also, because Pushkar is also saying that medicine questions were not that very simple. So you've got to genuinely prepare for medicine also. All right. So Pushkar, let's first discuss regarding the neurology questions, and then we'll come to the medicine part. So neurology, I just want to understand a few things. Number one, what was the level of toughness of the questions? Then about whether it is long stem, short stem questions, about image-based questions, and about the overall difficulty level also. How was it, the neurology section?
Yes, sir. So again, comparing this to the July AIIMS session, the July AIIMS sessions was predominantly one-worders, sir. I think you could say that around 70 to 80% of the questions were one-worders. So that was also a surprise this time. There were a significant amount of long stem questions, sir. Something that again was new to the AIIMS pattern. There was significant amount of long stem questions. And most of the questions were predominantly based on Bradley, sir. So for INISS, I think at least going through the Bradley tables and the important topics is a must, sir. Harrison is important, but I don't think it will be sufficient alone to read Harrison for this exam. So I think the level of the difficulty was okay, sir. It was a little more difficult than last time, since there were a lot of long stem questions with a lot of tricky options. The classical AIIMS pattern, which has a very simple question and very closely placed options, sir. I think.
Because I also agree to the same, because yes, there were a lot of questions which could be answered with Harrison alone, but there were some questions which was directly picked up from Bradley. like the question on, multiple sclerosis, the exact
Yes.
lines from Bradley.
Yes, sir.
So as you said, the tables in Bradley are important. Probably, you need not have 100% coverage of Bradley, but as you rightly said, especially the tables and core important topics, you have got to study well.
Yes,
And
sir.
also in Harrison, there are certain topics which are not that uh, given well, especially in stroke.
Inherited ataxias also,
So
sir.
yeah, stroke, inherited ataxias. So those topics also requires a little bit extra reading.
Yes, sir.
So Pushkar, like I think you have joined DocTutorials for some time. So can you just tell us, when did you join DocTutorials?
Sir, I had actually joined at around, I think June and July, sir, if I remember right.
Okay.
But I've been there since I've been attending the test for quite a while, sir. I
Yeah.
think I had become a subscriber around in middle of this year, sir.
Okay.
I've been
So I
there for
think,
a bit.
like, you have almost given almost all tests that we have conducted since then.
Yes, sir.
Like we had conducted initially to begin with, I had conducted subject-wise exams.
Yes, sir.
In fact, topic-wise exams like ataxia,
Yes, sir.
peripheral
Yes.
neuropathy, seizures, and we had conducted 2 rounds of such exams. In fact, we
Yes.
were doing the third round. That is when the exam pattern changes were there, and then we went ahead with the elite exams. I think you wrote those exams also.
Yes,
So
sir.
can you just go through, the exams? Like in DocTutorials, we had conducted
Yes.
the exams. So how helpful were those exams in your preparation?
Yes, sir. I think the doctoral exams are highly recommended, sir. Number one is because most of those who are preparing for neurology are going to be attending the test, sir, since it's very popular. So it will be easy for you to assess yourself where are you currently placed, since most of the prospective candidates will surely be taking the tests. And another important thing is most of the questions are novel. They are not repeated from the Q bank. So that's very important, because if you take a few other grant tests, it will be very heavily based on the Q bank. But in DocTutorials, 90% of the questions are novel questions, questions that we have not heard before, questions that are not from the own Q bank. So that's very important. So that is very useful, and all the questions were very relevant. It makes, like, there will be around 30 questions for each subject. It's split into multiple topics, and the 30 questions were placed in a way that it touched every aspect of the topic. So I actually had used it as a revision tool. So even after giving the test around 5 days before the exams, I had just gone through all the explanations of all the tests. It was an excellent revision tool, and it was very useful. I was primarily using the DocTutorials test schedule as my study schedule. It was easy to stick on to, and it's highly recommended for those who are preparing for
In
DMD.
fact, we had conducted so many exams also.
Yes.
In the DocTutorials app, rather than going for combined test alone, we
Yes.
had made sure that, okay, seizures, there will be a separate exam, epilepsy, and we had done multiple rounds of such exams
Yes.
without questions getting repeated.
Yes.
So that, at the end, you would have access to a good collection of questions, which you can
Yes.
easily revise. And I think, Pushkar, you were very consistent, like during the DocTutorials mock exam, because yesterday also, like, I was just checking the messages that we had in the WhatsApp also, like you were very consistent towards the end. Either 2-1, 2-1, 2-1. It's like, you were either rank 1 on the exam or 2, so or 3 maximum. So I think, the
Yes.
consistency was there,
Yes, sir.
especially towards the late phase.
Yes, sir.
Yeah. All right. So, the viewers also should know one thing. Pushkar has neurology in his genes. His father is also a very famous neurologist. So, Pushkar, can you just tell us about your father and how inspirational he was for you?
Yeah, sir. My dad's Dr. Palani, and my inspiration for neurology comes from him. Like, the moment I entered MBBS, I knew that I wanted to become a neurologist. Probably it's because of a significant influence from dad, and he's been helpful a lot, supporting me throughout. So it's surely an asset to have dad.
That's great.
He's been a huge inspiration.
That's great. So, Pushkar, like regarding the, you have just given us the pattern of questions for the neurology part, and
Yes.
you have given a fair idea to the viewers also. What about the general medicine part? You said the level of toughness, but again, how was the spread? Was it focused on any particular subspecialties, or was it general distribution for the medicine part?
It was equally distributed, sir. It was equally distributed, but I felt there was the neurology aspirants were a little lucky. I think there were quite a few neurology questions also in the general medicine part. And the problem is the questions were very tough, sir. I think a basic reading of Harrison is important. So I think first year and second year postgraduates who are watching this, make sure you do also read Harrison side by side while reading Bradley and neurology section of Harrison. Do not neglect it, because even for Neet SS it's important, and from now onwards I think it's very much likely that it's going to be very, very important for INISS also.
Okay.
So don't study only neurology. The rank deciding questions will be from neurology, but general medicine is a must.
Okay. So that is also clear. So, after the first round, that is the MCQ round, for the AIIMS, you had the interview round.
Yes, sir.
So again, this part also is very important, because next time also students will be listening to you after their MCQ round, preparing for the interview.
Yes, sir.
So just tell us, okay, if a candidate is getting selected for the interview and you are AIIMS merit list rank 1, so I think you are the best person in the country to say this. So what sort of preparation is required for the interview round? How different is it from the initial MCQ evaluation round?
Yes, sir. So number one point about the interview is there's not going to be much time between your stage 1 results and the interview. So it's not advisable to acquire a lot of new facts during this time. So I think most of you would have created some sort of your own handwritten notes. So just try to reinforce what you've already studied. And to be honest, I really hadn't read anything new for that. Rahul sir, not once, but I have attended his interview classes twice, both for the July session as well as this session. So sir has this very beautiful collection of MRA pictures, EEG pictures, and sir also makes sure that we speak out. Like there are many people who are very, very intelligent, but they have a little phobia when it comes to an interview. So sir makes sure that he asks each candidate individually, makes them speak out. So it's very important you do revise your notes, but it's also important you also attend sir's interview classes, because you will lose your inhibitions. It's very important to lose your inhibitions, and you should be your best self during that day. It doesn't matter how much the amount of knowledge you've acquired over all this time doesn't matter. It just matters how good you are on that day, how well you present yourself. So for that, you should make sure that you don't have any inhibitions. And I would highly recommend sir's class, because not once, twice for AIIMS interviews I had attended the sir's class, and it was more than enough for me to get selected. So yes, sir.
And every year, we conduct such mock interview sessions. So where I've already made a collection of the previous interview questions, and I share it in the group also. Like we had a close group of students who were selected, and then in that group also I shared, and then we conducted mock interview sessions also. And I think even this time, majority of the questions were mostly the same that was asked in the previous interview. Obviously, because certain examiners will be fond of certain questions, and they might feel, okay, this could be the rank deciding questions between candidates. So I even I see that many of the questions that students got, like say neurocystic sarcosis, or a acute management of stroke, or a hand muscle wasting approach, or a quadriparesis approach. So similar type of questions were asked. So I think, like most of that was covered in the previous interview sessions, mock interview sessions as well. So Pushkar, can you just let us know what were the questions asked to you, just to, give the candidates the feel of the questions asked?
Yes, sir. So my first question was about myasthenia gravis and about myasthenic crisis. So what happens is usually a candidate will get a set of 2 or 3 questions, and then the questions will further go depending on how you take the exam. So my question was initially about myasthenia gravis. Then the discussion went on to myasthenic crisis, how to differentiate cholinergic crisis from myasthenic crisis. How will you treat a patient, or how will you manage a patient in the ICU, the patient with myasthenic crisis? What are the different treatment options? And after that, what are the long-term immunotherapies? What are the antibodies? So the discussion will be depending on how you take the exam. So because I mentioned the word cholinergic crisis, the discussion went on cholinergic crisis. So it depends. So it's try to stay safe, like try to stick on to concepts you are strong with. Try to avoid things that you're not very sure of. And if you don't know something in an interview, it's better to say that I'm not sure, rather than saying something wrong. Just say I don't know, rather than trying to beat around the bush. So my first question is about myasthenia gravis, and then a detailed explanation about the treatment. And the second question was a clinical question. regarding how to differentiate intraaxial and extraaxial brainstem lesions.
So which means, it is quite evident that these questions are not very tough, but it's the way how you present. See, myasthenic crisis versus cholinergic crisis, even in like for your NEET PG exams also you'd be learning. But when it comes to a Central Institute interview, an AIIMS interview, it's how you present it. You agree with me on that, Pushkar? It is
Agreed, sir.
yeah, it's not just the just answering it, but how you present it.
Yes.
Because you should have the mind of a clinician. When you present it, the examiner should get a feel that okay, you know the subject well, and if you are actually handled a patient with a myasthenic crisis, you will do well. So that is very, very important. Okay. So Pushkar, like you have attended all lectures of DocTutorials in the neurology lectures?
Yes, sir. Most of them, sir. Yes.
So, okay. So like, just tell us how beneficial were the lectures for your preparation, and how did you plan your preparation? Was it like you would, write some notes from the lectures, or is it like, you would just add on the extra points to your textbook? How was it?
Yes, sir. So what I used to do is go from the basics, sir. So if I'm reading stroke, first I'll go through Harrison's. So Harrison's just gives you a gist of it. It might not give you much about the invasive procedures. So after reading Harrison's, then I go on to Bradley to add on the extra points, mechanical thrombectomy, the important trials. Then after making notes from Harrison and Bradley, I'll go watch your videos, sir. There will surely be some sort of extra points, these name signs or certain things that we might have not read. So this is the sequence or the hierarchy which I had followed for most of the topics, sir.
Okay.
Harrison, Bradley, and then video for extra points. I just used to jot down the things which I felt was I didn't like emphasize much while reading it in the first read in Harrison and Bradley.
Okay. And even for the exams that we conducted, so most of the questions that we conducted, that is the topic-wise questions, were either based on Harrison or maybe clinical questions.
Yes, sir.
But when it comes to the Q bank, we had set the level of toughness a bit higher.
Yes.
So,
sir.
Pushkar, you noticed that like the Q bank was not tougher place.
Q bank is more Bradley based. Sir.
Yeah, more
it's
Bradley.
It's an excellent revision tool for those who are reading Bradley. It is
so
word to word Bradley.
You have a 360-degree coverage of neurology where in the lectures we are covering everything. And then, in the individual topic-wise exams. And again, with the Q bank also, like Bradley is also covered. All right. So, and what was your rank in the INISS mock test that we had conducted?
A mock INISS was rank 1, sir.
Rank 1. So, you went an INISS rank 1, and here, AIIMS merit list rank 1 and common merit list rank 3. So excellent. So just one question for you. Like, see, you have answered most of the questions which a candidate who is preparing for the upcoming INISS should know. But just let me ask you, as a resident who is going to enter, like NEET PG, like they have cleared the NEET PG, they are entering their residency. So what advice as a senior, you would tell them on how to do medicine residency and then deciding on super specialty? So what will be that advice for them?
Yes, sir. So I think during medicine residency, I think it's enough if you start your preparation for competitive exams from the 3rd year. Just make sure you acquire important clinical skills, patient interaction. That's more important. It's important being first a physician, then a neurologist. So that's vital. So concentrate on your residency rather than chasing books. So first year, second year, just make sure you're full into your residency and giving more importance to, like upskilling your clinical skills. I think if you start preparation for DM neurology in your final year, that should be more than enough. That's what I had done. Sir. Yeah. When I was final year, I had started preparing.
Yeah. So I think, it's a common message which both Ankit as well as yourself are saying. That is, you've got to be a physician first and then a super specialist. Because I see a common mistake for many candidates just entering medicine residency. Okay, I want to become a neurologist. What book should I read from day one? So I think, you have got to focus on general medicine also, because I feel general medicine is where the actual charm is. Exactly. Okay, so, and then, you can just subspecialize on a particular specialty like neurology, cardiology. So which is also very, very important for everyone. Yes. So Pushkar, like, so you've got such a good rank. So where are you planning to join? Like, I know that you're actually considering a few colleges. So have you made a final decision?
Yes, sir. I'm either Sri Chitra or Jipmer, sir, because I'm recently married. I can't go too far. Yeah. So Jipmer will be a more convenient option, but Sri Chitra is of course, a very good college. So I'm a little confused what to take, sir. I think I have to make my decision by tomorrow.
Yeah.
So I'm just thinking about it, sir.
Yeah, we'll have a call also after this interview, and we'll
Sure,
just discuss that also.
Sure.
Okay, but anyway, like, you know, you have got the liberty to learn in any of the top institutes of the country, and that should be, you know, like a God-given opportunity. Not many get the opportunity, you know, like you can choose where you want, you know, like AIIMS or PGI, INISS, JIPPER. That's great. So thanks a lot, Pushkar, for joining.
Thank you, sir.
And let me just tell all the viewers, you know, what I feel, my gut instinct is not just about, you know, his academics. Pushkar is somebody who has the right attitude for neurology, and maybe in the years to come, you know, he'll be a very, very prominent figure also in neurology, just because he loves the subject. You know, there are certain people who actually have that attitude. Rather than learning for an entrance exam, his body language itself would actually show you like, okay, he's interested in the subject and he genuinely is in love with neurology. All the best, Pushkar.
Thank you, sir.
Okay,
Thank you, sir.
so for a happy professional and a personal life, okay, all the best.
Thank you, sir. Thank you so much, sir.